welcome. Thank you so much for being with us tonight. Are you allowed to unmute yourself? Let's see.
Sí,
I'm gonna see.
te voy a tratar de hablar en español, si puedo, sí.
Thank you so much.
Me voy a hablar, me voy a equivocar un poquito porque nunca practico mi español. Mi familia es de Monterrey, de México, y crecí con mis abuelos, pero entiendo todo se traduce en español, entiendo todo, pero como no practico, se me olvidan palabras. Pero te voy a hablar, mi presentación es en español, perdón.
Muchísimas gracias.
Y me quedé con un poquito. Buenas noches a todos. Es un honor que estar aquí con ustedes en Puerto Rico. Hoy quiero hablarles de algo que está cambiando la forma en que entendemos la recuperación, el rendimiento y el envejecimiento saludable. Es el producto que se llama LactiGo. Muchos que están aquí ya están usando, ya lo estaba usando por como un año en la clínica y ahora lo uso con todos mis atletas, todos mis pacientes. No le hace si están haciendo deportes, pero más importante es por los médicos. ¿Qué es LactiGo? Okay, LactiGo es un gel tópico que contiene el carnosina y sulfato de magnesio. Es basically magnesium sulfate. Es lo que está en Epsom salt baths. La única cosa que está diferente es lo que está dentro del gel, es ethoderm. Es diferente, that's what makes it different. Voy a hablar un poquito en español y en inglés, si se traduce está bueno. Pero ese es lo que trabaja. There's another product, no hay otro producto que tiene ethoderm. No nomás es que tiene carnosine y el magnesium, es el ethoderm que lo hace trabajar. Y lo aplicas directamente sobre el piel y se absorbe de forma rápida. No es una pastilla, no es inyección, no hay medicinas que, there's no medical interaction. So I don't have to worry as a doctor if it's going to interact, if there's going to have a side effect. I use it on kids all the way up to all my elderly patients. So no le hace. I mean, yo lo uso con todo. ¿Qué es el carnosina? Carnosina es un dipeptido natural. Es natural que ya existe en el cuerpo. Ya lo tenemos en el cuerpo. Se encuentra principalmente en los músculos, cerebro y el corazón. Es donde está, ya lo tenemos. Lo tenemos mucho cuando estamos chicos, pero después de 20 años ya se está, it's just already starting to deplete. ¿Cómo funciona? Pues primero reduce la fatiga muscular. Esa es la primera cosa que hace. Ayuda a controlar el ácido láctico, lo que permite menos fatiga, más resistencia, mejor rendimiento. También protege las células. La carnosina combate algo llamado glicación. Llamamos advanced glycation end products. Y ese es lo que te hace age. Te hace más, it's what wrinkles your skin. It's what hardens your arteries. It's what makes us older. It protects the cells, and we call it the longevity molecule. Mejora la recuperación también. Muchos usuarios reportan menos dolor muscular, recuperación más rápido, menos inflamación. Es la razón que lo estoy usando en la clínica, porque no hay nomás, there's just not one use. There's a ton of uses. The sports aspect is very easy. That's already been proven. There's studies on it. It's but it's all the other things that I'm seeing in the clinic, from diabetes that I'm using it for, So again, this is not, I want to preface everything when we're talking about LactiGo. I'm just reporting what I'm seeing. I'm not going to make any medical claims. I'm just reporting what I'm seeing in the clinic. Okay. We should never ever say that it cures, it heals, but I'm just going to report what I'm seeing in the office, and I'm using it for everything from diabetes to people with peripheral neuropathies, to restless legs, to just cramping, arthritis. I mean, any kind of itis. That's the easiest thing, is any kind of itis, any kind of joint pain, any kind of tendonitis, arthritis, any kind of inflammation of the joint. It just works very, very, very well. So, who's it for? Pues, beneficiar atletas, personas activas, personas con dolor muscular o articular, adultos que quieren empezar con salud, pacientes en recuperación. So patients that are doing physical therapy, patients are pre-surgical, post-surgical. If they're about to have a surgery, I have them use it before and after, especially after, to help recover. And cómo se usa es it's very simple. Es nomás lo pones uno o dos veces cada día. No lo puedes usar, you can't use it too much. So al menos dos veces al día, pero si tienen algo que duele, es 3 veces al día. Pero antes del ejercicio y después también. Y después el ejercicio es más por recuperación. So, pero it's very well tolerated. Okay, there's no side effects. That's the thing, is there's nobody that can't use it. That's why I don't have to worry about it. As there's no side effects. There's literally no side effects. There's no GI side effects. There's nothing, because it's just topical and we just put it on. So for the majority of the other supplements, in the past, there was a way that we tried to get carnosine into the body, and it was through the dipeptide that I mentioned earlier. So carnosine is a dipeptide of beta-alanine and L-histidine, both are amino acids. Beta-alanine is a precursor, and it's in a lot of pre-workouts. So anybody that works out may have taken beta-alanine, and in the hopes of it converting.
¿Soy yo o la señal?
I miss him, yeah.
Yes.
Se frizó un poco, sí.
Sí, lo perdimos.
¿Volviste?
¿Estás
de regreso?
No, está frisadito.
Yeah.
Am I good? ¿Separó?
Yeah, we see you.
Yes.
We hear you now.
Okay. So I don't know where it left off. Where did it freeze?
There is no side effects, was the last part that I wrote.
Gotcha. Yeah. So I don't have to worry about with anybody. So that's why I use it with everybody, and there isn't a single person that can't benefit from it. It just depends specifically what somebody's going to use it for. And in the beginning, I was using it specifically just for my athletes, for CrossFit or high rocks, or just lifting weights, and marathon runners, triathlons. But now there isn't a single it has so many. You caught how often to use it? It froze after that?
Estás por ahí, doctor. Es que la señal va y viene, y de repente te frisa, y de repente te escuchamos.
Okay, sorry.
No problem.
Está bueno, no? Okay. So I don't want to talk the whole time, because I know Dr. Tim and Chad are here, and if y'all have questions, I was just going to share just briefly what I've seen in the office, and if there's specific questions, I can answer those. But just kind of wanted to give an overview of what it is. It's just a topical gel of carnosine and magnesium. Every single person from children to elderly can benefit from it. Primarily 50 plus. If you're 50 plus, there's a single one of pain. So it's anybody with pain, anybody that has back pain. We go to bed and you wake up hurt, like somebody hits you in the middle of the night. So but it's true. I use it with all of my patients because it just helps them move better, feel better. And I can answer specific questions. I don't want to take up the whole time.
So we already had Dr. Willie Villarreal. Thank you so much for that intervention. And he has already answered some of the questions that we have right now in this presentation. And now we have Tim Sharp with us also. So Dr. Tim, are you there?
Yes.
Perfect. So the first question is, what exactly is LactiGo from a scientific perspective?
Well, I think Dr. Willie covered that pretty well when he talked about it as mostly a vehicle for delivering carnosine. That's the whole idea behind it, is trying to get carnosine, which has so much literature supporting a lot of different benefits, antioxidant benefits, anti-inflammatory benefits, anti-glycation, anti-aging, like a lot of the things that Dr. Willie talked about. There's so much research on carnosine having all of those types of benefits, and it just was never really effective as a supplement because oral carnosine, taking it as a pill, doesn't work very well. And as Dr. Willie said, the beta-alanine supplements, which is the other way people would try to do it, just didn't work very well. So in a nutshell, LactiGo is a great way to get access to carnosine and all the benefits of carnosine, but not having to take a pill, just being able to put it on topically, put it on your skin, and have it absorbed that way.
Excellent. Thank you so much. And one of the things that I see very interesting that he said, and we have been told many times, is that there is no secondary effects. So it's super easy to use in every person, like from children to adults, aged people, and it's very impressive, right?
Yeah, absolutely. That the only small caveat, or I guess another word, like small warning that I would say is anytime you try something new, particularly something that you put on your skin, you want to try a little bit and just see to make sure that it feels okay. There's a tiny chance that, you might have skin sensitivity or something along those lines. But in terms of a true drug reaction, a true side effect, there aren't really any real known side effects for carnosine. So, but if you put it on and something happens, trust your body. It's just, we haven't had that happen, and we wouldn't expect it to happen because its safety profile.
Sounds great. Sounds great. Let's go to the next question. What makes this technology different from others on the market?
Well, that's easy. We have almost no competition. We actually do have a couple of copycat products that have been released since LactiGo came out. And if they have the ingredients that actually make LactiGo work, like what is in our patent, then if they are currently selling, they won't be selling long because it's a patented product and it's not legal for them to do so. So that's typically not what the copycats would try to do. Normally what they'll try to do, and I've seen a couple of them out there, is they'll come up with some other concept and say that they're delivering carnosine, and then funny, they'll use our research, like the things that we talk about and the research that we published and that has been published on LactiGo as demonstration that their product is great. But what we know as the scientists who have actually done the work in this is the approaches that they're using to do it, we have tested and we know they don't work. So you can have a product and you can say it's topical and it's carnosine. That doesn't mean that it works, right? The very first study that was published on carnosine had carnosine without magnesium, which our patent is carnosine and magnesium together. And when the carnosine did not have the magnesium, it delivered almost no carnosine, right? When they put it on the skin, almost no effect. So what makes us different is we are honestly the only, we're the only topical carnosine product that not only is proven to deliver from biopsy work, from multiple biopsy studies, from human skin studies, but also just from a scientific, if you understand the science of how to deliver carnosine, I can also tell you that we're unique in that way, that the science that other people have is what is LactiGo doing and how close can we get to do that without violating the patent. And unfortunately, as soon as you don't do what we're doing, it stops working. So that's what's different, is we're delivering it, no one else is.
Excellent. Thank you so much. Let's go, Dr. Villarreal. If you want, I'm going to give you this question to you, and then Dr. Sharp, you can complete. How does the gel work once it enters the body?
Can you hear me? Okay. So that is a very difficult question to answer with just because there's so many different pathways. But again, the biggest one that we always talk about when we're talking about like Carnosina Academy, we're doing all these like presentations, is how it affects what we call advanced glycation end products, because that's what, when it lowers those advanced glycation end products, your body just functions better. So a lot of people, especially in the United States, are metabolically compromised. And what we mean by that is, you know, they have poor diet, poor lifestyle, that leads to a lot of like cellular damage. And so what's really cool about the carnosine is that it gets in there, and again, you can look this up. There's 3,000 plus studies. There's a ton of studies just on, you know, lowering hemoglobin A1C and blood sugars and all kinds of different pathways. But how it works in the body is just, it gets in there and it absorbs, and it works intracellularly. So it'll prevent, basically when we talk about buffering, it'll prevent, and at any time that I misspeak or anything, you know, correct me, Tim, I'm totally fine. You're the guru. But as far as intracellular, it will prevent inside the cell, the body from pumping out the hydrogen ion. So anytime that we have anytime intensive, you know, repetitive exercise, our body will start to pump out these hydrogen ions, and that lowers the pH, and that pH is acidic and it burns. So that burn you feel, that's that lactic acid burn. So what it does is it gets in there and it prevents it from, it buffers that. It prevents that from getting too high too quickly. And that's what will lead to the, like from the athletic standpoint, the fatigue, the heavy legs, the concrete legs, the burn that you feel, and making you want to like stop. But then afterwards, it helps, like personally what I see is like, it just helps. I wouldn't say flush it out. It just really buffers it. I mean, that's just the best way I could describe buffering it. But like I said, you know, the combination of the magnesium with the carnosine, like that magnesium sulfate, I mean, it has immediate, almost the thing that you'll hear over and over and over from patients is how quickly it works. I mean, it works very, very quickly. Now, again, if there's like inflammation, now I'm real quick to point this out, right? So if there's a structural issue, right, if it's a rotator cuff tear or an ACL tear, or they have like really bad mono, I mean, they'll feel better. It'll take the inflammation, but if they have that repetitive kind of like injury, it's going to, you know, I will temper expectations with that. But like in your typical tendonitis and your typical inflammation setting, it kind of lowers that inflammation like immediately. That is why we use it for like muscular, pain, for tendonitis, neuropathies, post-exercise recovery, metabolic health. Like I said, there's way too many uses for it, and it's hard to just kind of just focus on just one. But that's kind of just the way the carnosine, it just gets in and it replenishes what we used to have a lot of that we don't anymore as we get older. So that's why you've never heard of a 10-year-old. I talked to a patient about this today. You never heard of a 10-year-old, like they run. They play. They'll never say that they're sore. Why? Because they have lots of carnosine. They have lots of carnosine up until we hit about 18 to 20 years old, and then it starts to kind of drop off. So it just kind of keeps this. That's why we call it the longevity molecule, because there's a lot of longevity benefits, a lot of longevity studies on it. So.
Excellent. Thank you so much. Let's see. And this, I think, will cover also some of the things that you already said. How long, from your experience, how long does it take to experience full improvement when using LactiGo every day? Because sometimes the pain decreases when applying LactiGo, but then it comes back. Do you have to keep using it continuously to feel relief? You can take that.
Tim, it's up to you, Tim.
When you ask a question like this, the most important thing to ask first is, why is this person using it? Like, what's going on clinically with the person? So if Dr. Willie talked about if you have a rotator tear, right? That's a structural tear, and if you put on LactiGo and you get relief, you still have that structural tear. So the odds of you having to put LactiGo on to get relief again once it starts hurting are very high. You will very likely have to put LactiGo on right away. So the big message is, if you have a condition or a situation that is persistent, that is ongoing, then you would have to expect that you're probably going to have to put LactiGo on again, because whatever it is that you have that you're using LactiGo for is still there. Now, sometimes you run into people who they get stuck in a cycle, right? Maybe they have a history of injury, and what they have going on is really often like an inflammatory process that is trying to use too complicated. I would say self-perpetuating, but an inflammatory process that just continues on, even though the thing that originally caused it no longer exists. You can run into that very commonly in chronic conditions. In that type of scenario, it is entirely plausible or entirely possible that when you get that under control using LactiGo, that when you stop using it, you get yourself, you're no longer in that same condition. And then often what you'll see is, only if you push yourself too much, right? If you expect more from your body than your body can deliver, that happens to a lot of us as we age. I'm 56 now. I can't do what I did when I was 40. So if I overdo it, things that used to bother me will start coming back, and that's a great time to resume using LactiGo again. But if I don't have an underlying problem like a torn rotator or a torn meniscus, then it's certainly very possible to use it, have the problem go away, and then you don't have to use it again. But there are other scenarios where you maybe have to use it a lot And that's just the nature of dealing with the complex nature that we are as humans, right? we have so many stresses that affect us. I mean, even right now, I'm talking, I'm not really paying attention to how I'm sitting. Like I could be sitting straighter and supporting my posture and my body, and me not paying attention to that, I could get an ache in my back that I would need to use LactiGo for. And when I stop sitting like I shouldn't be sitting, the LactiGo takes care of the acute, immediate problem. And then me doing the right thing in terms of my posture and body mechanics solves the rest of that puzzle. So I guess that's the big message is it's important to understand your own personal puzzle and which pieces are out of place. And LactiGo can be a very powerful tool in helping put that puzzle back together. You just have to look at the other pieces and see other pieces you have to put together as well.
Exactly. Thank you.
When I recommend it, like I said, it depends on the specific use. You know, if they had just surgery I mean, I have them use it 3-4 times a day, and it just speeds up the healing process. I use it now specifically when I'm training, and here's the thing is, everybody needs to be exercising. Okay, period. It doesn't matter if we like it, don't like it. Like exercise is the #1 longevity tool that everybody could be accessing. But again, if somebody has an injury, if somebody's hurt, it's very difficult for them to move. It'll just help them move. And so like me now, yeah, I use it daily, but it's because I'm daily, and it's making my training and my recovery a lot easier. But then I'll have a tension headache at the end of the day, and man, I'll throw that right in the back of my neck, and man, in 5 minutes it's gone. So there's a lot of different uses. From the longevity standpoint, I see no reason why somebody wouldn't want to use it daily from now on. And simply because of the facial benefits, you know, the skin benefits, what you'll find is you'll just overall I haven't changed very much from my regimen, but you'll notice that when you use it on a daily basis, you'll just feel better overall. Like you'll think clear, you'll feel better. And I can't attribute it to anything different, you know, other than the LactiGo that I've added, because I haven't really added anything other than that in the last like couple of years. So yeah, I mean, again, it just depends. It depends on what you're using it for, but it has a lot of different uses.
Sounds good.
You know, that's a good point that you brought up, Dr. Willie, and that is, we all know that we should move. And I know some of you on this call, because I've seen some of you at some of the events, and I know some of you exercise a lot. Some of you exercise much more than I do even. And one of the things that LactiGo is great at is helping you push yourself, right? Helping you do what it is you know you need to do. Like some of us don't exercise because of how we feel the next day, or even how we feel during exercise. And LactiGo's tremendous for that. I'm a cyclist and a tennis player and a snowboarder. And between those three, certainly the snowboarding and the tennis are pretty high impact. So I'm pushing myself really hard. And I guarantee you, I always, before and immediately after any of that high intensity stuff, I'm absolutely using LactiGo. And then before and after cycling too, that's different because the cycling is more, you're doing it for a really long time and you're kind of draining yourself. It's a different kind of stress on the body. And I find that in each of those different scenarios, it helps me recover and feel better. Some of them, it helps me perform during, but most of us are not competitive athletes. I compete some, but most of us aren't competitive athletes, and we're often less concerned about how much better are we going to perform. We're a little more concerned about how am I going to feel after, and often also we're concerned with, am I not going to be able to exercise the next day because I feel so bad after today's workout? Like, am I not going to be able to work out tomorrow because I worked out today? Like, those are the questions that we have to ask ourselves. And often it can be very difficult as you begin leading an active life to continue that active life. It doesn't seem like it's worth it. So when you have a tool like this that can make that transition into a more active life easier, I mean, it's fantastic. And like Dr. Willie said, I don't know why you wouldn't want to use it.
That's great. So we have another question here. We talk about the side effects. There is a specific question. Are there safety studies for the gel, such as cytotoxicity, allergies, or side effects?
So in terms of directly testing LactiGo for those, because it's a cosmetic, you can look at the literature that exists on the ingredients that we're using, and we're using all very common ingredients. Everything that we're using is very common in cosmetics, and there are countless safety studies. So typically for a product like this, you don't go in and recreate studies like cytotoxicity studies, because there's no evidence in the literature of cytotoxicity of any of these. They're what's called generally regarded as safe. So to that level of detail, no, but it's not no because we're irresponsible. It's no because it's honestly just not really done for a cosmetic like this. Let's see whether the CARNOSINA. Were there any? I'm looking at a version of the question up on my screen. Were there any aspects of that I didn't answer, or anything that you want me to go into more detail on?
No, I think that will answer the question.
Okay.
I'll check.
I did want to say for allergies, you never know. Like I got a message from somebody a couple of days ago, and they said that they're allergic to sulfates. Okay. LactiGo has magnesium sulfate. Is it likely that there's enough sulfate delivered from the small amount of magnesium that is in LactiGo that is going to cause that person a problem? I would say probably not. However, if you truly have an allergy to an ingredient that is in it, you need to take that seriously. So that's not being allergic to LactiGo. That is, you have a chemical allergy that is very specific to you. So that's the only time that I've heard anybody mention anything that could be. And this wasn't someone who said they had an allergic reaction, but if you do have dangerous allergies, like you have an allergy that causes your throat to close up or causes you breathing problems, and it's something that is a known ingredient when you look at the ingredient list of LactiGo, of course, don't use it. But practically in the real world, it is extremely unlikely that someone will encounter that situation.
Sounds good.
I've used it going on close to 2 years with patients. I've never ever had a side effect reaction, even a skin sensitivity with it. So not saying that it couldn't happen, right? But I've just never experienced it, and I use it a lot. I mean, we cannot keep it on the shelf. We'll sell probably about 60 bottles a week.
And you're probably using it with a lot of patients that have some pretty serious health complications that are going to be more sensitive than many. That's another thing, is when you're working with sensitive populations and you still don't run into issues. That speaks well.
Como que another success phase.
Yeah.
Okay.
Sorry.
I think we have another question here. Has the effective contribution of carnosine or magnesium per milliliter of gel been measured in vitro or in vivo?
No, so the challenge here is there really isn't such a test, right? This isn't a question that can be answered. It's difficult to even measure carnosine. So there are some ways to measure it using an MRI, but it takes a very special MRI, and you can only measure it in very specific muscles, which are really deep. So like the calf muscles, you can measure using an MRI, but the muscle there is deeper than what most muscles are. So it's not representative of what it is you would find anywhere else in the body. You can also measure using biopsy, but again, if you biopsy, all you find out is how much carnosine is in that tiny slice of muscle that you biopsied. You don't know what it's doing, right? You don't know, is this acting as an antioxidant? Is this buffering? You don't get any kind of meaningful feedback on the activity of carnosine from the very few ways that we even have of measuring carnosine. So the best ways really to look at this are what we would call empirically, which is use it and see what kind of effects that you're experiencing. Outcome-based studies, like for sports, doing a performance study and looking to see what kind of performance would we expect or in performance benefit would we expect to see. And we have a great study, and the All Blacks study, where they did just that, and they got remarkable results. And the team now is a consistent purchaser of LactiGo. They use it regularly. So looking at outcome studies, and then also looking in the literature just to see what has been published on carnosine itself, because we know we're delivering carnosine because we've measured it in biopsy. Again, I can't tell you what that carnosine that we put in the skin, that in that actual biopsy study that we did, I can't tell you what that carnosine is doing, but I can look in the published peer-reviewed research literature to see what they've demonstrated that supplementing with carnosine does. And I know that our product delivers carnosine. And then I look to see what happens when people use it. And Dr. Willie looks at all the patients that he's used it with and what types of effects that they've had. And then you just kind of put that story together. But unfortunately, there's a technology challenge with being able to answer this question the way that it's asked, because there's no way to do it.
Now, from a clinical standpoint, like there's not a, like he's saying, not an exact direct, but like I do lactate blood threshold, lactate testing through blood. And so when we test like blood lactate at like increased workloads, it'll test that lactate threshold will basically it tests where the lactate starts to rise rapidly. That's a lactate threshold. What we see when we use the carnosine or the LactiGo, when we do the blood lactate testing, is there's delayed lactate rise. So it delays that lactate rise. So at the same workload, lower lactate levels earlier, it's lower accumulation curve. So basically what it is it's improving that buffering. So we're seeing that lactate threshold get further. So you get higher peak performance before failure. So, you can sit there and go, oh, well, it wasn't a study, but there was nothing else we were using. The only thing that could have affected that lactate threshold was the LactiGo that we were using. And so, that's one way that we test it. And there's like little blood lactate, tester. You can do them at home. We do them, we can do them serum wise, at the clinic, but there's blood lactate, testers that you can get portable. But we just see, just basically the athletes can sustain. So I've been doing this with a couple of like high rocks and CrossFit athletes. And especially, I did a couple of them during the Open, because the CrossFit Open was going on right now. And they were able to basically sustain higher intensity before hitting their threshold. And how we did it is we had them do the CrossFit Open workout one time without it. And then we had them redo it, because a lot of them are going to redo their open workout because they ran through it one time to see kind of how they run through it, how they feel. And then they'll always do it a second time, like harder, so they know how they feel. And, we had them do it. We had, some people do it before and after, and it completely like blew away their lactate threshold. I mean, it was really cool. And there's nothing else you could attribute it to other than using the LactiGo. So,
Great.
So that, I mean, as far as testing, that's what we did as far as testing.
Excellent. Thank you so much. And what do you have experience with patients with cancer? Could LactiGo help? Is there any scientific evidence of that, or what can you tell us about that?
We haven't personally used it with any cancer, but I'll let Tim speak.
Yeah, so that's talking about treating cancer is a giant red flag. So what I would tell you is that mechanistically, there is a lot that carnosine has potentially to offer to cancer, but we can't even get close to talking about using LactiGo in people that have cancer, other than the one thing that we have clearance in, at least in the United States. I know most of you probably aren't in the US, but the one thing that we can talk about is pain, right? That is fully within our legal ability and discussing the product and how it interfaces. So there, you're not talking about cancer, but what is a chief symptom that people that suffer with almost any form of cancer will complain about, and that's pain. So from that perspective, it's very promising. If you're curious about any other potential interaction, beneficial interaction that LactiGo could possibly have, the best I could do is tell you to look at some of the existing literature of carnosine and cancer. And at that point, you just have to think to yourself, does what I'm reading here in the research literature make me feel good about how I might be able to use this product that I have in my hands? But it's talking about disease in general, but cancer is definitely a big one. The regulatory authorities do not want you to
talk about diet. You can't even talk about diet with a patient. In the Mecca, MD Anderson, they'll still tell a patient here. MD Anderson is one of the largest cancer hospitals in the U.S., heavily regarded, and they will still tell some of my patients that diet doesn't matter. It doesn't matter when you have cancer, and that's total BS. Absolute total BS. Now, from a carnosine standpoint, it's going to be, just like Tim said, adjunct therapy for any of the things that the cancer may be causing, pain, any kind of like weakness, any kind of like cachexia, muscle wasting, things like that. But it wouldn't be like to treat the cancer directly. It is just any kind of ravages of the cancer.
Sounds great. And I'm going to go fast here because we still have 5 minutes.
You can't bring a scientist on a call with Q&A and ask it and expect the answers to be short.
Yeah.
Sounds good. What is the physiological mechanism by which LactiGo is able to relieve and its most acute cases eliminate pain?
So if we're keeping it simple, we can drill it down to the key mechanisms that we talked about, which is it's anti-inflammatory, antioxidant, and it's a pH buffer. And I guess the fourth, if you're dealing with the menthol variety, that's actually the reason we have a pain claim, is because of menthol. So menthol is well documented to alleviate pain. So I should probably frame it primarily as menthol, since that's what we are allowed to really say. But conceptually, the things that carnosine in the literature has been documented to do, those other three, the anti-inflammatory, the muscle buffering, and even the antioxidant impact. I mean, mostly it'd be the anti-inflammatory, but it's related. So that's my shortish answer.
Yeah. So, thank you so much. And here we have another one that says, if LactiGo can restructure the body's cells, where can I find information that explains how it does it?
I'm not entirely sure what the question is looking at in terms of restructuring. Do you know what's going on there, Dr. Willie?
No, yeah, because it doesn't have the ability to restructure a cell. It'll make it more efficient. I think it'll make your cells a lot more efficient. And so there's no real restructuring of a cell, really. It just the efficiency improves, makes your cell work better.
Yeah, I mean, the closest I could get, and again, this isn't really a claim that we could specifically say for LactiGo. This is carnosine, because I mean, really, even the pH buffering is that's a carnosine claim, not really a LactiGo claim, because we don't have any research that specifically shows that's happening. Although, I mean, that's a fundamental property of carnosine, so it's pretty easy. But I would say that you can get a lot of cellular dysfunction from an imbalance in your acid and base balance. That's redundant. So basically, if a cell becomes overly acidic, it's typically not going to function properly. So being able to buffer the pH and help prevent it from becoming overly acid like that is probably the closest I can think of to where carnosine might, it's not technically restructuring, but you could kind of prevent the destructuring of a cell. Just close to the question. That's probably the closest we can get.
It improves. I think it improves. You get better tolerance of acidosis overall. It's just, I mean, and inflamed tissues by definition are going to be acidic, painful tissues. So tendinitis, arthritis, anything. So it's the same thing like we see with that lactate, threshold testing. So.
Great. And we have 2 more to go. Is it only helps for musculoskeletal pain, or what other pains can it help?
You name the pain. I haven't used it. I'm trying to think what kind of pain I wouldn't think of using it for. I mean, I guess if my eyes were sore, I might not use LactiGo. Like you have to think what wouldn't I think of using it for in terms of pain versus what would I use it for? Chad and I are currently in the process of publishing a paper on cramping and LactiGo, and cramping is pain. And we saw a tremendous benefit there. So that's another like form of pain. Yeah, I would say if I had pain, one of the first things that I would think of, without even really qualifying it, is I would put some LactiGo on it. There's a funny video that has been passed around the internet for a number of years now that it's put some bacon on it. I don't know if any of you have seen it, and the joke is whatever's going on, you just put some bacon on it. And I often feel like LactiGo is a version of that funny song. So if you haven't heard of that, I would go onto YouTube and search. I think it might be rub some bacon on it, and then just think to yourself LactiGo when you watch that video. It'll give you a chuckle.
The last question, and think that your opinion for both of you, it will be crucial for us. How to approach a professional to explain the beauty of the product? What would be the main characteristics to talk about it?
Yeah. So the easiest thing that I bring up is, again, the risk-benefit ratio, right? So in medicine, we always look at, what are the risks? What are the benefits? If the benefits far outweigh the risks, then we go with it. And so for me, right from the very start, it ticked all those boxes because I don't have to worry about it causing a negative side effect. I don't have to worry about this patient being on a medication, having an interaction, having an allergy. There's no contraindications. There's no medical interactions. There's nobody that can't use it. So the benefits, again, far outweigh the risk. And that's the easiest thing. That's the easiest, selling point for me. And then the fact that it works, because you can talk and talk and talk about any new product and about this, but when I give them the sample, my biggest thing is I sample all my healthcare professionals, whether they're chiropractors, physical therapists, doctors. I will always give them, and because to me that's an investment, and I'm not saying that everybody should do that, but like to me, I give them a sample because I want them to feel the difference. And I'll tell them, hey, if you're going to work out or if you're going to do this, and the biggest one is I'll tell them to do that LactiGo challenge. I'll put it on, tell them to go do a heavy leg day or something and put it on one leg and don't put it on the other. And they'll see a dramatic difference right from that very start. But if chiropractors, if they have somebody with like what we call hot back or an acute pain, they can put it on their back and they'll feel relief right away. So that's how I share it, is just I sample people and then afterwards I have an info sheet that explains what it is and why they should implement it in their practice.
Sounds great.
So I fixed my setting. Are you seeing subtitles?
Yes, we see you in Spanish. Thank you so much.
You can repeat all the answer for the question.
Yeah, we'll start this over from the beginning. Hi,
yes, let's do it.
No, unfortunately, my answer here will be the least interesting because I am not a salesperson and I've never sold a bottle of LactiGo in my life. But I would say if people use LactiGo for different reasons. So again, I want to separate the claims of LactiGo does this versus the reasons why people use LactiGo. So right now I'm just going to talk about some of the reasons that people use it without claiming that this is specifically what it does. So people use LactiGo. One of the most common things that we see people use it for is I'll use the word recovery. It doesn't necessarily mean you played sports and the next day you're trying to recover from that. Most of us day to day is an exercise in recovery. It's an act of recovering from all of the things we did the previous day, playing with our kids, going, getting stuck in a subway, driving your car for multiple hours. There are so many things that we, just living life, need to have a little bit of help to recover from. So that's one of the things that we see a lot of people use LactiGo for, is to feel better from the day-to-day physical activity that they're doing, even if it has nothing at all to do with lifting weights or swinging a racket or going down a hill on skis, right? But there are those things too. So of course the athletes are using it to feel better after the exercise. Athletes are also, and not just professional athletes, like anybody, if you're intentionally moving, there's a good chance I would call you an athlete. So athletes are also using it to perform better. And again, we have studies demonstrating that. So if you want to perform better, if you want to feel better after you just had a hard, long day. Those are two of the big things that we see people using it for. And I mention that because what you want to do when you're selling it is you want to talk about the situation where real people are actually using it. And those are the core reasons why real people are using it. So give it to them and share those types of stories with them. Share the, the experiences that people might have. Because you might have someone who says, you know what, I'm not in pain all day. And then they might think, hey, maybe LactiGo isn't for me. But they just, the next day after they were really busy or they had a really hard day, maybe they're just not themselves. And it could be that LactiGo is the thing that, makes them feel like themselves again. So that would be my advice is if you've used it yourself or you have people that that have used it, talk to them about what their stories are and incorporate their stories into your story and share that. Just be careful not to make any really clear claims that LactiGo is going to do this for you, right? There's talking about stories like, we are here, and then there's LactiGo does this. The LactiGo does this part for regulatory reasons, because of the government. We have to be careful not to make those very clear types of claims. But you can certainly share the stories that you have personal.
We'll ask him. Any other comment on your part that that it's that would put some other information that you feel that is important for us to get?
Well, my clinic is primarily longevity, wellness, anti-aging, preventative medicine. And to me, I mean, it's all going to come down to how do you want to age? We're all going to get older, period. You're either going to age very, very well or you're going to age very, very poorly. Okay. This has been one of the greatest tools that I have seen in my clinic over the past 10, 15 years that will help make a big difference because nobody has to learn how to do it. You don't have to, you literally apply it to where it hurts. There's no injection. There's no, there's all kinds of anti-aging longevity tools that are out there right now. And a lot of my patients come in asking about them and they don't understand that one of them requires an injection every day. And one of them does this. This is so easy to do. And, I like to preach it. It's not about really longevity, it's not really anti-aging medicine, right? Because we're going to all age. I like to look at it as anti-decline. So it's more of, how can we make people, how can we extend people? I say this all the time. How can we extend people's health span, right? How long you live healthy, how long you move well. And that's kind of the goal, at our clinic is to help you live longer, better. And LactiGo just helps with that.
Thank you so much. Thank you so much.
I have one question for Tin or Dr. Willie, because someone sent me these questions. They told me about why does using LactiGo increase pain in some people?
Increase it?
Yes, increase
it might be referred. I mean, that's the only thing I can think is that they may have had that pain and it's relieved in one part and it just kind of highlights the fact that they have a pain somewhere else. That's really the only thing that I can think of is referred pain, but it shouldn't cause any pain in other parts of the body.
Yeah, there's no mechanism for it to specifically cause pain. So I think Dr. Willie is accurate in not dismissing what this person said, but absolutely referred pain is possible. And if it's not clear, you can have a pain that limits your range of motion, right? So say you have a pain in your shoulder, and with the pain in your shoulder, you can only move your arm to here. You put LactiGo on, that pain goes away, and now you can move your arm to here. Well, it may turn out that you have another physical problem in your shoulder that you never even knew you had because you couldn't move your shoulder to here before, and now you can, right? So that LactiGo is not causing pain. We run into this. You can run into this in neurology. Like I remember the first neurology patient that I treated, I don't know, 25 years ago. They lost feeling in their fingers, and I started working with them, and the first thing I told them was, when your fingers start to recover, you're actually going to start to hurt. Like that's the first thing that's going to happen, because if we're successful, which we were pretty successful, you're gonna start having feeling like those nerves are gonna start to fire, and that doesn't feel good, and you hopefully get through that process. But that's not the treatment causing the pain, even though the pain followed the treatment. There's a very specific difference. So there is no plausible scientific explanation for carnosine actually causing pain. There are very rare explanations of why someone could have pain after they took carnosine, but it would be the same as if you did physical therapy and you got more range of motion, and now you were putting stress on a joint that you couldn't before because the muscles weren't strong enough to stress. Like it's a similar process like that. And the only other similar version of that I would say is there's a gate theory to pain where you can actually mask pain with pain, right? And that's
or vibration. I use gate theory of pain for vibration when I'm doing a pellet. I'll vibrate, and they do that with Botox too. I'll use a Theragun on the area that I'm going to inject local, and they don't feel the local anesthetic when I'm using the vibration gun, but it's gate theory of pain is what it's doing.
Yeah, that's or if you're at the dentist and they give you an injection in your cheek, and that they'll flick your cheek. So you can have that same type of thing it's possible that's happening to where and again, this is going to be very rare, but you could have a pain that when you use LactiGo, it resolves that pain, and due to this gate theory that we're talking about, you no longer have the thing that was serving as the closed gate for this other pain. And so now you feel you always had both, but one is kind of blocked by the other pain. So I'm talking about this a lot. I don't want you to think that this is something that happens commonly. It is extremely uncommon for you to have two pains and one is masking the other one in that way, but it is technically possible to happen. So those are the only things that I could think of that if someone asked you the question, why does some people feel pain after they take LactiGo? I would say not many people, maybe one person. It's just that one person is asking the question.
Yes.
So it sounds like it's a lot because it's in public.
No, I think it's not possible that cannot be a healing crisis. It's not possible.
That you mean like as they're healing, they're feeling pain because they're healing? Is that?
Yeah. It's not possible.
So I mean, a little bit, but the example that I gave about the treating the patient with neurological damage,
okay,
when they felt pain, that was because they were healing. But most conditions that you're going to have as you heal from them, the primary symptom isn't typically pain, right? So it is technically possible, and it entirely depends on the nature of whatever the injury or whatever the pain is that we're talking about. But as a standard characteristic of pain, that is not a normal characteristic of pain. Certainly technically possible, but I'll tell you this, if that is the case, and the progression, like the healing progression, you're gonna, say this is where you heal this much and you have pain and you heal to here, you're not gonna get better if you don't hit that point. The only thing that you want, and this is what I told my neurology patient, you don't want to heal to there and then stop healing, right? Because then you're stuck with the pain. Again, very rare. This is not something you should worry about as a LactiGo user. Just when you're, if you're one of the 1 in 10 million people where this happens, what you want to do is focus on the progression of healing, so that the plateau that you were at, that stopping point you were at where it did start to hurt, you get past it because your healing process continues. So yeah, Juan Carlos said it is technically possible. Just go past it, and also very rare.
Yes, is if for someone that used the product and he is the answer that he told, that he used the product and the pain is increasing in his body. So I sent to him that is possible as heal increases. So, but I want to know, because you are the science, you are the doctor, you know more than us right now. So
Yeah.
Team Sharp, I know that we have a lot of time right here, and Dr. Willie, I know that chat is in other. He trying to join us, but really, team, I want to say thank you for being here, to pass time with us. Dr. Willie, the same. I can speak to you in Spanish because tú hablas español y puedo fluir mejor
Pues
en el
yo entiendo, pero no me acuerdo palabras.
Pero
Muchas gracias por su tiempo. Muchas gracias por tenerme.
Gracias por venir aquí con nosotros y contarnos desde ese punto de vista de esa práctica médica que tú obviamente estás en ese día a día. Y te quiero comprometer a que venga un día a hablar en español con nosotros.
Un día quiero ir a Puerto Rico.
Yeah, we thank you so much. We at the Latino community here, all of us take very seriously to be the voice of this product, and that's why we are here with you, learning from you, from your experiences, and I'm sure we're gonna go ahead and tell to everyone that is possible. It could represent a change in their life. That's what we know it could happen. So we really thank you so much, because I know that you are super excited. We see it this hour and a half almost with us. We really appreciate it. So thank you so much for being here with us.
Thanks for having us.
Yeah, you're welcome. Thank you.
Thank you. Have a good night, everyone. Gracias.